The warning from the CDC, the coronavirus is spreading so quickly around the globe, it may only be a matter of time before it begins rolling across the U.S. with the potential to become a pandemic.
The World Health Organization says the risk of the virus expanding worldwide is now classified as very high. And there are new cases of the disease here in the United States.
As the coronavirus impacts communities around the globe, here at home, Asian Americans are facing more than just the fear of contracting the virus. They say that hurtful and misleading language from our nation's leaders are now making things worse.
Along with a growing number of infections, the coronavirus is spreading fear and discrimination against Asian Americans.
The coronavirus is impacting communities across the globe, but here at home, it's also leading to some disturbing occurrences. Many in our Asian American neighborhoods are reporting that foot traffic is down and business has slowed to a halt. Even more troubling, we are seeing a disturbing rise in hate-filled attacks. This has now led some to worry about how to defend themselves, and gun sales are actually up in certain neighborhoods.
COVID-19, coronavirus, or my personal favorite, the Rona. This virus has reshaped our entire reality and shook the foundation of countless systems we rely on worldwide. And perhaps the most obvious cookie to crumble in this crisis has been the U.S. healthcare system. In the last few months of 2020, we have seen things like discrimination and xenophobia directed at Asian Americans, all the way to essential workers from our communities dying at excessive rates of COVID-19. Today, let's dig into exactly what's been going on for Asian Americans facing discrimination. And then let's get into how the U.S. healthcare system works right now and meet some of the Asian physicians working to make it better. My name is Nidhi Shastri, and this is Model Minority Uniquely American. Hey guys, what's up? For this episode, I wanted to first address the anti-Asian sentiment that has arose following the coronavirus's arrival in the United States. Then we're going to explore in what ways the U.S. healthcare system has crumbled under the pressure of the demands caused by COVID-19, leaving the most vulnerable communities in our country to sit in the mess. Now, I'm sure by this point, we all know how the Trump administration has dubbed the coronavirus the quote-unquote Chinese virus or the Kung flu. This type of rhetoric has caused Asians from many various identity groups, including people who identify as Chinese, as well as people who are from broader East Asian and Southeast Asian countries, to face increased levels of discrimination. According to a report called Unequal Consequences from the nonprofit South Asian Americans Leading Together, or SALT, in April alone, there were over 3,000 reported cases of Asian American discrimination. SALT's report comes with an interactive map, which allows you to click through each incident individually to see the stories of discrimination people had to face. And according to a 2020 report from the Center for American Progress titled "The Coronavirus Pandemic is Fueling Fear and Hate Across America," in New York, there have been multiple reports of physical attacks against the AAPI community, often accompanied by derogatory and racist verbal abuses. And we know from previous episodes, many New York City Asian Americans are low-income essential workers, leading them to be easier targets when out and about. In California, one incident ended with the hospitalization of a 16-year-old San Fernando Valley student who remained unnamed in a report from ABC News because his family feared the backlash that they would get for speaking out. And in Indiana, 2 Hmong men were denied a hotel room out of fear of coronavirus. Nationwide, Asian Americans experience blatant and subtle microaggressions involving social exclusion, racism, and fear-based backlash. Asian Americans have also reported that even sneezing or coughing can trigger harassment and violence. A friend of mine, Clarissa, decided to test this theory out in her own life, and what happened when she did was actually terrifying.
Hey, I'm Clarissa Dow, born and raised in the one and only Chicago. I work for the AmeriCorps, and I identify as a Filipina American. during the pandemic, I'm like Chinese passing. So everywhere I went, like everyone was scared of me, right? The start of the pandemic was probably around March and April. So I've noticed, like, I came back to U of I for unofficial. I was just there to visit my sister, and I remember vividly going to the Marketplace Mall, and I noticed that the townies, they're not the most well-rounded, open-minded people as it is. But like that day, I noticed that they were very, very different. Like they were scrutinizing me for some odd reason, right? So like everywhere I went, like everyone was looking at me, like everyone looked at me with disgust. I was very frustrated about it. And I remember vividly, like one of the incidents was like I went into the Target bathroom, right? And like I come out of the stall, wash my hands, and then another woman comes out. It was a white woman. I think she was an elderly white woman. And she just looks at me at disgust and watches me the whole time as I'm washing my hands. So I'm here like, you're really you're seriously looking at me, making sure I wash my hands. But you can't even wash your hands for at least 21 seconds? Like, what is that, you know? And I even wrote an article about it. It's called Being an Asian American During the COVID-19 Pandemic Means Facing Constant Xenophobia. Yes, a long title. Check it out one day. It's from Odyssey. And it's I basically talk about xenophobia, how the pandemic induced that in terms of the Asian community, and like how Asians did react to this. Like I saw in my feed, like a lot of Asian Americans did not know how to react to people discriminating against them. It's so unfortunate because again, not enough Asian Americans talk about social issues. Or again, they're lumped into the model minority, so they never really dealt with that before until March or April, you know? I remember when I dealt with it at Target, people kept staring, and I was testing it out, right? I was like, let's see how people really feel, right? So I coughed, and everyone like literally went ballistic and like avoided me. And I'm like, y'all gotta be kidding me. Like I go to the doctor every year. I'm clean, relax. Like I was just so mad. Like stop staring at me. Like what are you looking at? I was so mad. It was just like, wow. And then like coming back from that, like I was like my friends didn't understand like how scared I was. Like they would be like, come on, let's just like don't like they didn't really understand like the fear I had because I was scared to go outside because of my experience in Champaign-Urbana, you know? So I was like, for a good month, I was scared to go outside. And every time I did go outside, like in the beginning of the pandemic, people would stare at me. And I'm fortunate enough to like, you know, be outspoken, but like at that point, I can't always do that because it was like a sensitive time. Like, you know what I mean? Like, I don't want to put myself in danger. So I'm just like, I just have to deal with it.
This anti-Asian discrimination has reignited the historical idea of the perpetual foreigner stereotype, which is the idea that no matter how many generations of Asians or other immigrants stay in the United States, they will always be seen as foreign or other. It's the same reason why when people see an Asian person without hearing them speak, they assume that they're an immigrant. It's also why people are so taken aback when they hear an Asian person speak with no accent and in pure American English. And the backlash towards Asians has expanded far beyond simply boycotting Chinese businesses. It has effectively lumped all East Asians and even some non-East Asians together and deemed them all as a tangible threat. Some of the demographics bearing the brunt of the anti-Asian backlash are actually Southeast Asians, essential workers such as people who own Thai restaurants and Vietnamese beauty supplies. This is all rooted in the idea that all Asians look alike and therefore must all be the same. Now, this concept dates back to post-World War II America and the sentiments of anti-Asian xenophobia. I spoke with Kevin, an academic who identifies as Vietnamese American, who shared his thoughts on this.
So my name is Kevin K. Nguyen, and I am from Orange County, California, more specifically in Little Saigon within Southern California. So I identify myself as Vietnamese American. So overall, I'm currently a student affairs professional, but also a scholar. So I'm working towards in becoming a scholar within higher education, with an emphasis in Asian American students, but also professionals and such. I think the hard thing with the coronavirus, COVID-19, it has really affected creating more bullying, more false assumptions about this population, and the hard thing is it creates more incidents of like racism of Asians, because I'm like a lot of people are attacking other populations, even though it came from China, but like also really attacking different other Asian American populations. The huge example that I would say is the Vincent Chin incident of back in the day, of how like he came from a Chinese American background, and how the attackers thought he was Japanese, and that's kind of for me I just wouldn't want those type of incidents to happen again. And the hard thing, I mean, slowly they're trying to create ways of create unbiases about the situation.
The situation that Kevin is referring to is the story of Vincent Chin, a Chinese American who in June of 1982 got in a squabble with two men. After the men accused Chin of being the reason that they lost their jobs at Chrysler, the car company, Chin ran from the fight on foot. According to History.com, the two men spent 20 minutes hunting him down, and once they found him, they beat him to death. They received a small fine in court and no jail time for the killing. The issue of job outsourcing that many Americans blamed on Japanese car manufacturers continued to be taken out on Asian Americans in the form of discrimination and microaggressions, regardless of country of origin. It's a heartbreaking story. And now, as Kevin said, we are living with the fear of history repeating itself. Hate crimes against minorities have gone up under the Trump administration. In fact, hate-related violence hit a 16-year high in 2019, according to an article from the New York Times featuring an FBI report on the topic. And this idea of hate increasing has also led into another problem: the dehumanization of Chinese deaths. When the pandemic first hit, many Americans were very afraid, and rightfully so. However, there was an uptick in the idea that Chinese people deserve no empathy for the reality for which they are facing while trying to handle and contain the virus. I think it goes without saying that not all Chinese citizens and individuals are responsible for the virus, and yet they were the first to see their own communities die from it. A friend of mine, Shui, shared her experience with me about being an immigrant from Wuhan, China, and how insensitive people could be to those dying or caught in the panic, people who could have very well been her own family members.
Hi, my name is Shui. I'm a Chinese American. Recently graduated from the UIUC with a bachelor's in liberal arts. I'm a psychology major with minor in community-based art education, and currently I live in Bridgeport, Chicago. So I made a Facebook post on January 29th. That was like after like a week of like the huge outbreak of coronavirus in China. And the reason why I made that post that day, talking about, you know, how we are seeing all these numbers of cases being reported, and at the same time, like a lot of hate crimes are happening across the world because of the fear for, you know, the virus that expanded to, you know, to become the fear for an entire group of people. And it was really hard for me at that time, like all the anxiety and like awareness for my family in China led me to make that post after I read about a family who like basically just lost everyone to the virus. and I was reading the daughter's diary, just describing, everything that they had to do and like everything they witnessed, and just trying to put myself in their shoes and then thinking about how I could not bear that kind of loss. And then seeing all these, hate comments and like crimes that are happening against a group of people who's already vulnerable, who's already anxious and fear. It was just not right. So I made that post, and to my surprise, it got shared multiple times by my friends, and I received a lot of support, and I was really, really grateful for that. And also, I'm really thankful that I'm surrounded by, supportive, reasonable people who didn't let me, directly experience that, that resentment. I just remember, before coronavirus actually, broke out in the United States, I went to class with a face mask on because I was actually having flu, really unfortunately at the same time. And just the anxiety that I sensed from people around me, I was like, okay, yeah, this really could happen. People, if I was in a group of people who was more anxious, who was maybe less reasonable, I could be attacked. So I went home and I didn't go back to class for the rest of the week until I recovered. But then it was really hurtful for me to see, as the coronavirus became, a global health crisis, and as it expanded to the United States, just the way that people have been talking about the virus, talking about China, talking about the government, I felt like a lot of times it was really insensitive to people who really just wanted their family to stay alive, who really are just doing their best to get through this hard time. And it really didn't help that, our president made such comment, calling it a China virus, Wuhan virus. Yes, it originated from there, but the consequences of that label is what we should be aware of.
So, as I was conducting these interviews and researching this segment, this concept of dehumanization reminded me of post-9/11 America, where so many South Asians and Arab Americans were lumped together and faced brutalization for many years, with lasting surveillance policies and deportation measures against Muslim Americans that still exist today. But for East Asians, there has been one positive action: the passage of a resolution in the U.S. House of Representatives which condemned anti-Asian sentiments. Politicians have been debating whether there is a proper terminology that should be used when discussing the virus. But for a lot of Asian Americans, like my friend Daniel Lin, who identifies as Taiwanese American, it's more than just rhetoric. It's a perception issue. He spoke to me about one of the negative stereotypes that has come out of this virus, a view of Chinese people as barbaric or inhumane for eating unconventional animals, such as bats. It's important to remember that everything is relative and differs by society, including what animals are quote-unquote normal to eat and which animals aren't. For example, in the United States, it's normal to eat beef, but for many Hindus in India, eating any meat is considered inhumane. Daniel spoke a little bit more about his thoughts on this stereotype, both in the context of the United States and the people living in China.
My name is Daniel Lin. I went to middle school and high school in Southern California, near Los Angeles, and I studied at the University of Illinois at Urbana-Champaign. My parents are from this island called Taiwan, off the coast of China, and I guess my ethnicity you can call it Taiwanese or Chinese. Yeah, doesn't really matter to me. In China, you can see there's a significant gap between the older generation that lived through kind of poverty versus generation today of people around our age or younger whom didn't really experience that poverty, and then also had things like the internet and things like that. So even in China itself, a lot of people would are kind of demanding that hey, let's not eat dogs, hey, let's not eat this, let's not eat that. So it's I can see here people are saying oh yeah, it's like they eat dogs, it's like they eat bats and things like that. But I guess what they have to realize is like even in China, most people are against eating dogs, eating bats, and so so you shouldn't stereotype like an entire country of like 1.4 billion people to, I guess, like a couple of examples of, you know, like individual cases. It's kind of like you know, it's like if you have a bad tradition, it's like nowadays here's the reason people don't practice is because like most people do not agree with it, but there's still gonna be, you know, a few people. Does that mean that everybody is finding the same thing like acceptable? No, but like it's just that in a country that big, there are bound to be like a few people who want to try things.
In addition to the stereotype, there has been an outcry for China to pay up as a result of this virus being created. According to an article from April of 2020 in Newsweek, the Republican Senator Rick Scott said that the American public will want to boycott Chinese goods after the coronavirus pandemic, and U.S. resale companies such as Amazon should help by listing where the items are made. However, this rhetoric hasn't been by any means limited to foreign goods. It's led to the boycotting of Asian beauty salons or supplies and restaurants, places that aren't actually a higher risk for contracting COVID-19 in anyways. A friend of mine, Brian Chen, expressed his views to me on why he feels trying to hold the country of China accountable for this virus is a bit ridiculous.
My name is Brian. I'm from I grew up at I was born at Texas, Austin, but I grew up at Taiwan, Hsinchu, and now I'm studying at Georgia Tech, ECE MS. Yeah, 23. Okay. So I think the cases at Asia is doing a lot better compared to other part of the countries. There are some people putting the blame on Asians. I think that's pretty dumb in my opinion, because there were, remember, if some people probably remember this, the H1N1 also originated from United States, Mexico, I think more specifically, and there was also the Spanish flu that was also originated from Spain, I believe. Yeah, that's why I call it Spanish flu. So it's kind of funny that how some people just like say, oh, I don't know, countries like China should like pay money or like to those countries who suffer because they didn't contain the virus. That's just ridiculous in my opinion. So yeah, they should feel ashamed of themselves if they have this kind of mindset. That's how I feel. I think the Asian countries generally are doing pretty okay job with containing the virus at this point. So that's good. I hope Europe and the United States can follow up and keep and then kind of tone down this virus a bit. I really hope so. And I think I worry about myself more and my friends at the States more than at Taiwan. Taiwan is okay. Yeah.
Brian's right. The United States has grossly mishandled managing this pandemic, as seen by our current trend of rising cases and the current death toll. So Americans should be worried. But suffering physical symptoms is unfortunately not the only stressor for Americans right now. It's also the collateral damage that families and even individuals would face if they did get sick. What do I mean by this? According to a mini-series by PBS NewsHour on the American healthcare system, the recent job loss resulting from the coronavirus pandemic has left over 30 million people unemployed. And since the U.S. ties its health insurance to employment, it's also left them uninsured and underinsured in the middle of a global pandemic. Furthermore, for those employees who have lost their jobs after contracting the virus, they now face even scarier realities for how they're going to pay for treatment if they end up needing it. I spoke with Dr. Winnie Lin, a pediatrician in Chicago, about her story and about how the American healthcare system can only complicate things for people in our communities, such as elderly Asians like our parents.
My name is Winnie Lin. I am a pediatrician. I'm originally from the suburbs of Chicago and now live in the city of Chicago. And my ethnicity is Asian. Both my parents are immigrants from China. There were very few times that I went to the doctor as a child, which is funny because I'm a pediatrician now. But I mean, my parents would just take me, for the required minimum school shots. And then like one time I had pneumonia and was fevering for, over a week. And so they were finally like, okay, maybe this isn't just a regular cold. But I definitely sprained my foot in dance camp and my foot swelled to twice the size, but my parents didn't take me to the doctor and just sort of rubbed Chinese oils on it and sent me back to dance camp, and it just kind of eventually walked it off. Or I one time had a full body rash that was extremely grotesque looking. I think it was some sort of reaction to poison ivy that spread everywhere. But I didn't go to the doctor for that either. My mom just kind of rubbed lotion on it and just waited. So looking back now as a pediatrician, I'm like, oh my goodness, I can't believe I survived all that without seeing a doctor, because the patients I see, they'll come to me for way less than that. But my parents just had such a high threshold for going to wait in a waiting room and paying a copay, and then, talking to a doctor that you didn't necessarily trust, and then getting prescribed medicines that you didn't necessarily trust or that weren't explained to you in a way that you understood. So yeah, it's very frustrating, especially now that my parents are older. They should be, my mom should be getting her mammograms, and fortunately they're pretty good about colonoscopies, but they're definitely not doing everything that they're supposed to be doing from a health maintenance standpoint for adults in their 60s. And it can be frustrating, being a doctor myself, having gone through med school, trying to convince them to do these things, and them kind of feeling like they know better and they don't trust the system as much. And I think part of that lack of trust is unfortunately justified, because from a patient's perspective, our guidelines are changing all the time. There's new research coming out all the time. 1 year we'll recommend these tests for everybody, and then the next year we'll say, oh, actually we don't need that anymore, or it's this new thing. Vaccination schedules change, and so it can be really hard, even just for doctors to keep up with all the latest guidelines, and then to have to translate that to patients and to keep their trust that, we really know what they're doing is hard. There are, I think, a lot of hidden vulnerable Asian Americans out there who might not be counted by the census and might not be as visible in terms of political power and influence or in the media. In Chicago, we have both a Chinatown and a neighborhood called Asia on Argyle, which is predominantly Southeast Asian immigrants. People in those neighborhoods are often recent immigrants or older immigrants who are not as proficient in English. Many of them work service jobs, or particularly during this pandemic. A lot of them are essential workers, like the ones who are preparing your food, people who are doing cleaning. And so to say that, Asians are fine and we don't have to worry about them because they're all well off is definitely a lie.
We see these issues in South Asian communities too. I spoke with Alankrita Sadula, who we've actually heard from before in the socioeconomic status episode. She is currently a medical student, and she explained to me a bit more about how South Asians have unique healthcare issues that go overlooked.
My name is Alankrita Sadula. I'm from Chicago, and I'm currently in my last year at Rush Medical College with the hopes of continuing onto a general surgery residency next year, and I'm South Asian. So the U.S. healthcare system is absolutely atrocious. It's based completely on an ability to pay. So that means there is a lack of access to the healthcare system for a lot of immigrants and low-income people that either don't get insurance from their employer, and it's ridiculously expensive to get insurance outside of employer-sponsored care, and hence go without. So when you don't have access to care, you have poorer health outcomes. And for South Asian communities specifically, it's not just a lack of access to care. There's also a high level of poor health literacy and a lack of trust in doctors, even though a lot of South Asians are pushing their children to become doctors. They have a general lack of trust in doctors, and they don't really adhere to instructions from doctors. They would rather follow, more traditional forms of medicine from back home rather than listen to doctors here. So there's many factors at play here that negatively impact the health of South Asian communities. And this affects both physical and mental health, of course. So my mother is a diabetic, a type 2 diabetic. So that's an acquired illness. And a lot of minorities are more likely to have type 2 diabetes entirely due to the fact that they just lead such stressful lives. They have a lack of access to good, nutritious foods. They have a lot of stress when it comes to their day-to-day lives in terms of their jobs, in terms of making ends meet, in terms of family. So all of this compounded, of course, results in developing type 2 diabetes. And when you have a lack of access to care, regular care, you can't really engage in preventative medicine. So if you're not seeing a doctor regularly because you don't even have insurance, you don't even have a doctor, then you don't know what conditions you are at the threat of developing. So, of course, through most of my childhood, we did not have health insurance. So my parents never saw any doctors, and we would kind of pay out of pocket to get school physicals filled by some clinic down the street. And later in my teenage years, we were, once we had become green card holders, eligible for the WIC program, Women and Children, insurance for women and children. And it was then that my mother found out that she had diabetes. If she had regular care, if she was able to follow up with a doctor regularly previously, she might have been told that she was, on the border, pre-diabetic, and she should really, follow these steps to make sure she never goes over that precipice of developing the disease. But, she never even got that warning. And so she just had full-blown type 2 diabetes when she first got to see a doctor after a long time, and was saddled with this, list of medications to take, this whole and she had no understanding of what this disease was or how it came about or what she should be doing to improve it. So she would buy into these ridiculous gossip in South Asian communities of eating ginger in the morning or raw garlic would help your diabetes and stuff like that, instead of actually considering and learning about what her condition is and why she should be taking medications at a certain time and what her medications actually do for her. So in that way, our healthcare system is really bad for the South Asian community. And then even when they do get to access care, there is no considerations for the cultural context that these people are coming in with. There's no education about the context of what their community and family and work life is like, so the doctor can work with them to figure out a way to meet their needs. And then the patients themselves have poor health literacy and a lack of trust in doctors. So at every level, from access all the way to treatment, there are barriers that keep South Asian Americans from doing well.
According to the stats from Pew Research Center, over 60% of Americans say the government has an obligation to provide health care to all. But what exactly is a universal or single-payer system? Dr. Lin described it in 2 main points.
So single-payer healthcare is a healthcare system where instead of our current system where you have lots of different private health insurance companies, some public health insurance options, instead of all of that, you would just have one single payer, which would be the government. So it would be publicly funded healthcare. Everyone would have the same insurance, but we would keep our current system of private providers. So all the doctors, hospitals would remain the same, and everybody would have more choice in terms of where they could go, because you wouldn't have in-network versus out-of-network providers. Everyone would just need to accept that same publicly funded insurance. And so it would basically take that sort of financial risk out of the equation for whenever people need to seek healthcare. And so the goals of this are to, number one, make sure that everybody has health care, so not just the people who get it from their job or not just the people who can afford to pay for insurance from the marketplace. Number two, it would reduce disparities. So right now we know that the people who are dying at highest rates from COVID are Black Americans, who also tend to be, lower incomes, who also tend to be essential workers, who are more exposed, have more untreated chronic conditions, because they don't have that access to healthcare in the first place. And so we would start to be able to reduce those disparities and have more equitable outcomes.
The aforementioned PBS NewsHour report went into depth about how low America's healthcare system actually ranks when compared to countries with universal healthcare, such as the UK, Australia, and Switzerland. According to the article, the metrics for the US aren't looking too good, as we fall behind all three of those countries and countless others. Business Insider ranked the United States 27th in the world for a healthcare system. Some American critics have been very vocal about criticizing how a universal healthcare system could ramp up wait times and swamp doctor offices. I asked Dr. Lin about the reality of these types of critiques and how she would respond to them.
Well, I think for that, the best sort of rebuttal is real data. So if you look at studies of countries that have single payer, such as the NHS in Britain and the system in Canada and the system in other kind of Northern European countries, and you look at those average wait times, they're not worse by any significant stretch. I think that when people are making those arguments against single payer, they're kind of cherry picking just bad experiences that individual people will have to kind of prove their political point. But all in all, if you survey those countries, people are much more satisfied with their healthcare than they are here. Obviously, any sort of change in system is going to have some things that to get used to, but on the whole, administrative costs are going to go down. We're going to have way less paperwork. Doctors would have more time to actually see those patients rather than, fighting with insurance companies. So if patient volume goes up at some places, I don't think that overall, people are going to suffer from that. There is no excuse to have millions and millions of Americans, in one of the wealthiest countries on earth, having no insurance at all, just because we're worried about some slight weight increases at some theoretical high demand clinic. I think that's just absurd.
Remember back in episode 1 when we talked about how when the model minority myth was created, it used Chinatowns as the blueprints for ideal, successful, and wealthy minority communities? Well, today, some of those very Chinatowns lack ample healthcare staff and clinics. Dr. Lin helped explain this with an example.
In Chicago, I learned this as I was looking for jobs after residency, that right now there's almost no pediatricians and barely any doctors at all in the Chinatown neighborhood. And so there are a lot of Chinese people now going to Pilsen, which is like a nearby neighborhood that's predominantly Latino, but now like getting gentrified. So they're kind of having to like go across the river to outside of their neighborhood to seek care. And you see that paralleled in like rural areas as well. So places that are less financially well off, less politically powerful, clinics and hospitals have less incentive to be in those areas because if they're taking more Medicaid patients, they're going to be losing money compared to if they are having patients with private insurance. And so we've seen that a lot of these clinics and hospitals in underserved neighborhoods are closing down. Hospitals are continuing to close down on Chicago's far south side and in rural Illinois. And if we just got rid of this disparity between public and private insurance and reimbursement, then we wouldn't see those subsequent disparities in access to care. So I think, well, part of the disadvantage that Asian Americans can face is, like I said, the language barrier. So right now our system is extremely confusing. Even people who are native English speakers often, can't understand their insurance claims or can't understand how to like make an appointment, can't read their bills, don't know like what documents they need to sign up for insurance or to see a doctor. And so all of that, any step of that can be a barrier. And then needing to be in a position of privilege, essentially to have insurance in this country, is another issue. So if you are, a cook at a restaurant, or you're part-time, like how my dad used to have temp jobs where, he was driving or cleaning, then you're not going to have health insurance through those kinds of jobs. So our system makes it so that your insurance is tied to employment, and to specifically good full-time employment that includes benefits. And so there are so many millions of people who are being left out right now, and especially during a pandemic. We know that the essential workers and minorities are the ones getting sick at high rates, and then they're passing on the virus to everybody else. And so having a system where we don't have universal health care in such a rich, wealthy country is, I think, shameful at this point.
Currently, under our privatized system, some of our problems include rising premiums, increasing costs of treatment, unreasonable drug prices, and even simply not being able to afford a trip to the emergency room in an ambulance. But another critique against a universal healthcare system has been that taxes will go up drastically, putting the weight of paying for the system on the middle-class Americans. However, according to Alankrita, the weight is already on the middle class and everybody else, and the only way to actually lower the cost is by replacing the system.
Yeah, so currently people are paying into a system that someone else is using. So when you pay your insurance premium, it's going into a pool of money that is then being used to pay for the healthcare costs of someone else. So you are already paying for someone else's care, even through an insurance system. On top of that, most people that have insurance are already paying for the uninsured and underinsured that end up using our care. So about 60 to 70% of healthcare spending is done by public money. So when it comes to our military, our public school teachers, our congressmen, they're all getting healthcare sponsored by taxpayer money. So your taxes are already paying for other people's healthcare currently. And if you want to be benefiting from that, on top of that, then wouldn't it be better for you to also be paying for your healthcare through taxes rather than paying your premium next to paying your taxes? So single payer is definitely the answer to our healthcare woes, and it is definitely the answer for our South Asian community, because our community encompasses people from the entire spectrum of economic status, from immigrants that don't have the safety net of Medicaid and hence don't have the luxury of being able to access care. So it would help South Asian immigrants that suffer from healthcare costs or avoid care or are constantly in fear of needing any kind of care. It would help low-income South Asian communities that, despite having access to care, maybe they can't afford their co-pays, etc., and it keeps them from accessing care. And of course, it would help even the rich South Asian communities because it would take away how much of their paychecks are going towards healthcare. Right now, a family of 4 can see 20% of their household income go towards healthcare. So for a lot of the well-off South Asian communities, which most of them are still like upper middle class, they would still see savings in terms of how much money they're spending on healthcare. So across the board, regardless of where you are in terms of your life circumstances as a South Asian American, you would definitely see more benefits with single payer.
And why should minorities in specific care about these things?
Well, I think we're only as healthy as our least insured or our sickest member of society. So, when we have people who are going to work because they have no other way to survive, they're risking their lives, to cook and clean and drive buses and all of that. And then they're getting and dying from the virus and spreading it to other people. Like, that really should be a wake-up call for everybody. For minorities in particular, we have specific disadvantages where, besides language, like there are cultural barriers. Some people, especially like, for example, some members in my family who maybe don't trust trust doctors or, Western medicine as much. And so are less likely to have primary care, to go to the doctor on a yearly basis and get their scheduled cancer screenings and all of that. And then we know that it's those people who have the untreated chronic conditions who are more vulnerable to die from something like COVID. And so in a perfect world, I think we would have a system where there is, number one, access free at point of care service for everybody who wants healthcare, but also culturally competent care that takes into consideration, people's language barriers, people's hesitations towards medicine, and really works collaboratively with patients to give them the care that they need. My own dad, he suffers from a chronic neurological condition, and he was actually diagnosed with it. My freshman year of college was, the year of the 08 financial crash, and he got laid off. And so, luckily my mom was still working, so he was eventually able to get on my mom's insurance, but he was on unemployment for a while. And it took him a while to get diagnosed. Like, he was just feeling weak and didn't know what was going on. And it was one of those people who just never goes to the doctor, doesn't really like accessing the healthcare system in general. And eventually he was diagnosed and got the medicine he needed and is now living pretty much a normal life. But it was really scary for a while, not knowing and just having that uncertainty.
What we need to understand is that people are dying now, so we need healthcare reform now. But what do we do when, even in a global pandemic, when racial inequities and our healthcare flaws are being laid out in front of our eyes, it still feels like an impossible task? And if you're like me, the thought on your mind might be, why aren't politicians doing anything about this? Well, first and foremost, money plays a big role in politics. And right now, insurance and pharmaceutical companies are bankrolling even our most democratic Asian politicians. This creates a conflict of interest in enacting a national healthcare system, as we wouldn't need big insurance companies or pharmaceutical companies with a national system. Also, many politicians cite difficulty working across the aisle. However, Pew statistics indicate that even 55% of Republicans support continuing programs such as Medicare and Medicaid, so in reality, working across the aisle and doing what's right isn't actually that difficult. Plus, it's kind of in the job description. All I can do is promote that we demand better, wherever we are and in whatever state. Make your voice heard and advocate for the most vulnerable of our community to be protected. Because, as we've seen in this episode, Asian Americans and model minority communities are some of the first to suffer the consequences of our current system. And in this pandemic, it's something that we can't afford to have happen. But even if you can't advocate or do anything like that, my biggest ask of you is that you research this. If you're hesitant to support something like national or universal healthcare, do some research and find out if the privatized system is actually what you believe in or simply something that you need more information about. Because if nothing else, we can strive to learn how to build a better world, one Google search, one policy change, and one podcast at a time. That brings me to the end of this week's episode. Big thank you to everybody who showed up to advocate for this cause on this one. If you liked what you heard and want to contribute, find my Patreon at patreon.com/modelminority. If you want to leave me a note or a comment on this topic, go to our Facebook or Instagram page, Model Minority, Uniquely American, and drop me a note. And as always, shukriya, thank you for listening, and I'm so glad to have you here.